It was shocking. It was a surprise. It was scary. My neck got swollen, difficult swallowing. I had pain, fatigue, mental fogginess. My feet were swollen, and I had difficulty walking and climbing stairs.
She was exhibiting classic symptoms of hyperthyroidism, or an overactive thyroid gland. It's also, in medical terms, called thyrotoxicosis. The most severe and could be life-threatening cause of thyrotoxicosis is Graves' disease. And if it's not diagnosed properly and handled properly, then there could be long-term effects and even death.
I was pushing myself quite a bit too. I never stopped working a day for the 2 months that I literally had difficulties walking. I run a practice and I had tons of stress, traveling every other week.
It was really shocking as a physician. I've known her over 18 years. I've never seen her sick. She's lived an impeccable life of high-quality nutrition.
I sleep really well, I sleep early, I meditate every single day. I have really good practices. I was able to keep it up, but nevertheless, at one time, things shifted.
Because of her health history and how healthy she is, it was extremely unusual, and it proves to me that no matter how well you take care of yourself, you can still get sick. Her heart rate was elevated, her blood pressure was up quite a bit. She was having some anxiety, she was extremely fatigued, which goes along with this particular condition. We did some blood work, and those labs showed hyperthyroidism. Purely from a medical perspective, the treatment, you would be taking anti-inflammatories, and if the overstimulation and hyperthyroid state was so bad, there are drugs.
Instead of giving medications that eventually would get me out of balance even further and pile up more side effects, I shifted my diet.
From the beginning, she was impeccable with her nutrition. And I can only imagine if she wasn't, how much more serious this would be, because she was in a lot of pain.
When Dr. Garcia contacted me in regard to the difficulties that she was having, first thing I thought of is, what can you do to better meet the nutritional needs of your body, and what can you do to help your body get rid of what it needs to get rid of? Of primary importance is I take into consideration what's in harmony with someone's metabolism, but also what's in harmony with their blood type. I recommended that she keep her nutrition very simple, but keep the nutrition coming in and keep the nutrition as easily digestible as possible to conserve energy, because digestion is an energy expensive process, and if you're putting nutrition into your body that requires very little digestive effort, you're allowing your body to use more of its energy for detoxification and rebalancing. I recommended that Dr. Garcia do some raw chicken egg nutrition, of course only from healthy, organically raised chickens, but I recommend that she do small amounts of that, but do that throughout the day. I also recommended that she do vegetable juice nutrition. Dr. Garcia was a big fan of vegetable juice nutrition for a long time, and I recommended that she do what I thought of as a much more appropriate serving size for her, and to do the juice frequently, like with the raw egg nutrition. Also, I recommended specifically that she put some cruciferous vegetables into her juice. Cruciferous vegetables are the vegetables of the broccoli cabbage family, which also include cauliflower and kale and collard greens and Brussels sprouts, cabbage, radish, kohlrabi, rutabagas, turnips.
That was a major turning point in Dr. Garcia's health. And I can tell you from a medical perspective, I don't know any physicians that even consider in a thyrotoxic state to give cruciferous vegetables.
The cruciferous vegetables have some wonderful nutritional value for overall health, but cruciferous vegetables also contain some unique phytocompounds, phytochemicals, that actually can slow down thyroid activity. especially if you consume them raw, where you're running the vegetables through a juicer, and the juicer is actually creating a concentrate of what's in the vegetable.
Since then, I've been 100% raw, and that includes the meats, the vegetables, the fats, and I feel better now than ever. As I talked to Dr. Grasso and Jim, this condition that was triggered has a hormonal part. I'm going through a perimenopause.
There's always a stimulating factor with this particular condition, whether it's a virus. Stress is very common. And in her case, you know, she was sensitive from a hormonal perspective, and that was the precipitating factor. Physicians never really tell you what caused it. They see your symptoms, give you a drug.
Dr. Grasso did help me, you know, throughout this time with the osteopathic treatments. I checked my mouth to make sure that my cavitation sites, whatever I had in my mouth, it was not of any challenge, because that could precipitate it. Some issues there too could weaken my already hormonal predisposition, and my status in my mouth was pretty clear. I did everything that I do to you as a patient and that I advise you to do.
If the body's always trying to be healthy, then why do people develop problems like Dr. Garcia developed? Just thinking logically, consider that there was something she needed at the time that she wasn't getting or wasn't getting enough of. And let's also consider that there was something in her body that her body was trying to get rid of, that it wasn't doing so well at getting rid of. And that could be related to a particular hormone in her body that was staying around in her bloodstream longer than it should have been.
One thing that I always tell my patients is that when they're going through this perimenopause phase, everything becomes overwhelming for our bodies. And when I got this condition, I was navigating through this perimenopause, still having my cycles, but in a very easy way. So when I decided to shift my diet based on their advice, that's when I felt the starting of this recovery.
Her faith in trusting her body, this is something that we all practice in our offices to help our patients to do, and she epitomizes that, and went through 2 months or so of really agony, and she completely recovered.
I think it's very important that one message you're taking from us today here is take foods into consideration, to take osteopathic treatments into consideration, to allow your healing process to be free to do what it needs to do.
You have to trust your body, and you have to know that your body can heal anything.
Consider that your foods can be your medicine, and that's why you eat the great things you should be eating in order to support your system to regain and be available in its own healing.